National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Jonathan Beatty here, naturopathic doctor and a health expert at Nationalnutrition.ca. Today I want to talk about a very important topic in health that often gets overlooked by many naturopaths and physicians, which is dental care, dental health. Your teeth are very, very important as a window into your overall health. You know, I often refer people to dentists when they've got all sorts of different mouth issues, and the reason for that is that I really do believe that dental health is, where most health starts. In fact, certain people that have certain heart problems actually are required to take antibiotics before they have dental work done, because many dental infections can actually go directly to the heart and cause cardiovascular disease. That's how important oral health is to your overall health. So maintaining healthy teeth is really important. One of the first things we have to understand about our teeth is that they are a living tissue. We often think of our bones of our teeth as these sort of, like dead tissues. They're just a structure that's there. No, they are living, breathing tissues. They have nerves, they have blood flow. Teeth are very, very important. And they're a living tissue. They're not dead. They are constantly repairing themselves. And that's why it's important that even if you do have some dental decay problems, that you really focus on your oral health, because you can make it better for the future. So there are a few things that we're going to touch on today to ensure that you've got adequate oral health. So you have to realize teeth are a living tissue. And part of that is that they're embedded in your gums. So part of healthy teeth are having healthy gums. So we can't talk about oral health without mentioning both the teeth and the gums together. Because if you have a problem with one, you're likely to develop a problem in both. So, some of the things that are really important, obviously managing infections. Dental cavities often occur because of an infection with certain bacteria that help to erode the teeth. Now, yes, that has to do with poor oral hygiene. If you don't brush enough, sometimes the way your teeth form, they form incorrectly and create little pits. And these pits basically act like bacterial houses, and they can cause you to have cavities. So having the right bacteria in your mouth can actually reduce the bacteria that cause dental caries, or what we like to call cavities. So, some of the bacteria, we often think of probiotics. Well, there are specific probiotics for your oral health. The most important ones are Streptococcus salivarius, which is a specific type of strep that lives in your mouth. And specifically, is what we call Strep salivarius K12. It's a very specific bacteria that has been shown to help prevent cavities by outcompeting the harmful bacteria that are in your mouth. Taking a normal probiotic is not going to be effective, because those probiotics are typically designed for your colon. And obviously the bacteria that live in your intestines are very different from the bacteria that live in your mouth and in your oral cavity. So you need to make sure that if you are going to be using a probiotic, it's one designed specific for the oral cavity. It's going to be much more effective, and that's that Strep salivarius K12. Very important for preventing dental caries. As I alluded to, dental hygiene is important. Proper brushing is really important for dental health. Making sure you spend 2 whole minutes brushing at least twice a day, ideally brushing a little bit after every meal. And the reason behind that is what you're trying to do is just basically eliminate any little bits of food that are caught in the teeth and around the teeth that are going to then feed the bacteria, allow the bacteria to colonize, and allow cavities to be made. Now, if you do have cavities, I highly recommend getting the porcelain or other fillings. I do not recommend the silver amalgam. The reason behind that is it's 48% mercury by weight, which is a known neurotoxin. In fact, the country of Sweden outlawed mercury amalgams in 2008. Unfortunately, North America has not caught up, and there is direct evidence of oral amalgams off-gassing mercury, which there's no known safe dosage of mercury. So any exposure to that can be harmful. So I really recommend against using any type of silver amalgam, as in my personal opinion, They are completely toxic and should have no role in dental health care. If you do have mercury amalgams, make sure you go speak with a dentist qualified for their removal, because one of the most dangerous times for a mercury amalgam is during removal. That's one of the times where it could off-gas the most. And you also want to ensure that your dentist and your dental staff who are doing the removal are also protected against the dangerous fumes that occur when removing a mercury amalgam. So it is something to consider. Check out our other article on mercury detox if this is something you're going to pursue, because of course what you want to do is make sure you're protecting yourself against the toxicity of mercury as best you can. Other things to focus on for dental health, of course, the gums. You want to ensure that your gums are nice and healthy. One of the ways that you can do this is ensuring adequate vitamins for collagen production. One of the first ways we identified vitamins was actually vitamin C, and how we identified it as a vitamin, which is an essential nutrient required to, or an essential molecule required to prevent disease. And vitamin C was discovered essentially because of scurvy. And what happens is, without adequate vitamin C, your body cannot properly produce collagen, and you can't properly make the connective tissue in your gums, and you'll lose your teeth. Your teeth will literally start to fall out of your head. That's one of the major symptoms of scurvy. So obviously, ensuring adequate dietary vitamin C intake is very important for proper gum health. You also want to ensure adequate lysine and proline, as these things are needed with vitamin C to make the collagen, make the connective tissue that is going to hold your teeth firmly in your mouth. Also, having healthy gums ensures a nice tight seal around the base of the tooth. And what that does is it prevents infection from getting down into the root of the tooth and getting buried deep inside the jaw. The trouble with dental infections is, for some of them, it can cause 50% erosion of the jaw bone before it'll even be picked up on a dental x-ray. So for these reasons, it's much more important to prevent dental caries and prevent problems than to treat, because obviously an ounce of prevention is worth a pound of cure, and will save you a very large dental bill. So I hope these tips today ensure that you have proper oral health, healthy gums, healthy teeth, so that you can chew your food properly, liberate all the beneficial nutrients from a healthy diet, and ensure you have overall health for years to come. Check out more of our videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.